Airway management is a cornerstone of advanced cardiac life support, or ACLS. It involves establishing and maintaining a patent airway to ensure adequate oxygenation and ventilation. A compromised airway can rapidly lead to respiratory arrest and cardiac arrest, emphasizing the critical importance of prompt and effective airway management in emergency situations. Healthcare providers must be proficient in various airway techniques to address a wide range of clinical scenarios encountered in ACLS. In emergency medicine, seconds count. A patient's ability to breathe can deteriorate rapidly. Having a systematic approach to airway management is crucial for healthcare providers. This approach should include a rapid assessment of the airway, identification of potential obstructions, and selection of the most appropriate airway management technique. Failure to manage the airway effectively can have dire consequences, including hypoxemia, brain injury, and death. The ability to maintain a patent airway is fundamental to patient survival. Mastering airway management techniques is not merely about knowing the steps, it's about understanding the underlying principles. Healthcare providers must be able to adapt their approach based on the patient's specific needs and the evolving clinical situation. This essay outlines essential airway management techniques employed in ACLS, providing a comprehensive guide for emergency medical personnel.
The head tilt chin lift maneuver is a basic but highly effective technique used to open the airway in unconscious patients. It is often the first step in airway management. This maneuver involves two simple actions: tilting the patient's head backward by applying gentle pressure on the forehead and lifting the chin by placing the fingers under the mandible. This action aligns the airway by lifting the tongue base away from the posterior pharyngeal wall, allowing for unobstructed airflow. To perform the head tilt chin lift, position yourself at the head of the patient. Place one hand on the patient's forehead and gently tilt the head backward. With the other hand, place your fingers under the bony part of the chin and lift the chin upward. Avoid pressing on the soft tissues under the chin, as this can obstruct the airway. Maintain the head tilt chin lift while assessing the patient's breathing and providing rescue breaths if necessary. The head tilt chin lift is a relatively simple technique, but it should be performed with care. Excessive force when tilting the head can cause spinal injury, especially in patients with suspected cervical spine trauma. In such cases, the jaw thrust maneuver is preferred. The head tilt chin lift maneuver is generally effective in opening the airway of unconscious patients without suspected cervical spine injuries. It is a fundamental skill that should be mastered by all healthcare providers involved in emergency care.
The jaw thrust maneuver is an alternative airway opening technique used when there is a suspicion of cervical spine injury. Unlike the head tilt chin lift, the jaw thrust does not involve tilting the head back, minimizing the risk of exacerbating a spinal injury. This method displaces the mandible anteriorly, pulling the tongue forward and opening the airway. To perform the jaw thrust, position yourself at the head of the patient. Place your fingers behind the angles of the patient's jaw below the ears. Apply upward pressure to lift the jaw forward. Avoid placing any pressure on the patient's neck. Maintaining the jaw thrust, assess the patient's breathing, and provide rescue breaths if necessary. The jaw thrust maneuver is a critical skill in trauma situations where cervical spine injury is a concern. While it effectively opens the airway, it can be challenging to maintain for extended periods. In some cases, additional airway adjuncts, such as oropharyngeal or nasopharyngeal airways, may be necessary to secure the airway. Remember, the primary goal in trauma situations is to avoid further injury while ensuring adequate oxygenation and ventilation. Nasopharyngeal airways, or NPAs, are flexible uncuffed tubes inserted into the nasal passage to maintain an open airway. They are particularly useful in patients who are conscious or semi-conscious and have an intact gag reflex. NPAs are also well tolerated by patients who may not tolerate an oropharyngeal airway. Selecting the correct size NPA is crucial. Measure the distance from the tip of the patient's nose to the earlobe. Lubricate the tip of the NPA with a water-soluble lubricant. Insert the NPA into the nostril, advancing it gently along the floor of the nasal passage. If resistance is encountered, try the other nostril. Once the NPA is in place, ensure it is secured to prevent dislodgement. NPAs are relatively easy to insert and are generally well tolerated. However, there are potential complications, including nasal bleeding, mucosal irritation, and if inserted incorrectly, the possibility of dislodging a nasal bone. Monitor the patient closely for any signs of discomfort or airway compromise after NPA insertion.
Oropharyngeal airways, or OPAs, are rigid, curved devices that are inserted into the mouth to prevent the tongue from obstructing the airway. They are primarily used in unconscious patients who lack a gag reflex. OPAs come in various sizes, and selecting the appropriate size is essential for effective airway management. To determine the appropriate OPA size, measure the distance from the corner of the patient's mouth to the angle of the jaw. Open the patient's mouth using a cross-finger technique or a tongue depressor. Insert the OPA with the tip facing the roof of the mouth, rotating it 180 degrees as it passes the tongue, aligning it with the natural curvature of the pharynx. Once in place, the flange of the OPA should rest against the patient's lips. While OPAs are valuable tools in airway management, improper insertion can push the tongue back and worsen the obstruction. Always ensure the OPA is the correct size and inserted with the proper technique. OPAs are contraindicated in conscious patients or those with an intact gag reflex, as they can induce vomiting and aspiration.
Suctioning is the process of clearing secretions, blood, vomit, or other foreign materials from the airway using a suction catheter. It is an essential part of airway management, ensuring a clear path for ventilation and oxygenation. Suctioning can be performed with either a rigid Yankauer or a flexible suction catheter, depending on the location and nature of the obstruction. Before suctioning, ensure the suction device is connected to a working suction source and that adequate suction pressure is available. Select the appropriate size and type of suction catheter for the situation. For oropharyngeal suctioning, a rigid Yankauer catheter is often preferred. For nasopharyngeal or tracheal suctioning, a flexible catheter is necessary. Insert the catheter gently, applying suction only while withdrawing the catheter. Suctioning should be performed cautiously, as excessive suctioning can cause trauma to the airway, hypoxia, or cardiac dysrhythmias. Limit suctioning to 10 seconds or less at a time, allowing the patient to recover between attempts. Always have oxygen readily available when suctioning a patient's airway.
Advanced airway management techniques, such as endotracheal intubation, are often required in critically ill patients who require definitive airway control. Endotracheal intubation involves inserting a tube into the trachea through the mouth or nose, providing a secure airway and facilitating mechanical ventilation. This procedure is typically performed by trained healthcare providers using specialized equipment. Endotracheal intubation requires a thorough understanding of airway anatomy, pharmacology, and equipment. The procedure involves visualizing the vocal cords using a laryngoscope and then passing an endotracheal tube through the vocal cords into the trachea. Once the tube is in place, it is secured and its position is confirmed with a chest X-ray or by detecting carbon dioxide in the exhaled breath. Other advanced airway devices, such as laryngeal mask airways, LMAs, and King LT airways, may be used as alternatives to endotracheal intubation in certain situations. Advanced airway management techniques are complex and require specialized training and expertise. However, they play a vital role in managing critically ill patients with compromised airways. Mastering these techniques is essential for healthcare providers working in emergency departments, intensive care units, and other critical care settings. Mastering airway management skills is not optional. It is an absolute necessity for healthcare providers involved in emergency medical care. The ability to establish and maintain a patent airway can be the difference between life and death for patients experiencing respiratory distress. Proficiency in airway management techniques translates directly into improved patient outcomes, reducing morbidity and mortality rates associated with airway compromise. Healthcare providers must dedicate time and effort to acquire and maintain these vital skills. Regular training sessions, simulations, and hands-on practice are essential for developing confidence and competence in airway management. Staying updated on the latest guidelines and best practices ensures that healthcare providers deliver the highest quality of care to their patients. The consequences of inadequate airway management can be catastrophic. Hypoxemia, brain injury, and even death can result from the inability to secure an airway effectively. By prioritizing airway management skills, healthcare providers can significantly impact patient outcomes and fulfill their ethical obligation to provide the best possible care. In conclusion, airway management is a fundamental pillar of emergency medical care and a core component of ACLS. Healthcare providers bear the immense responsibility of ensuring patients in respiratory distress receive prompt and effective airway management. From basic maneuvers like the head tilt chin lift to advanced techniques like endotracheal intubation, each skill plays a crucial role in maintaining oxygenation and ventilation. The ability to assess, manage, and secure an airway is not merely a technical skill, but a critical element of patient safety and survival. Healthcare providers must continually strive to enhance their knowledge, refine their techniques, and embrace ongoing training opportunities. By prioritizing airway management and maintaining the highest standards of care, healthcare providers can make a profound difference in the lives of their patients facing life-threatening emergencies. Certify today at affordableacls.com.